Hi, good morning Ruben. My name is Angela Chris. I'm your invigilator for the OET speaking session on the 7th of June 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Ruben Neum.
And what is your candidate number, please?
My candidate number is 201524023.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What advice would you like to offer to your fellow nurse?
Nursing is a profession which requires high alertness and cautiousness. Though I am not a person who consistently complains and makes fusses, still I would like to advise all nurses to not do gossip and household talks during the shift. Further, I am too open to some entertainment post-completion of my shift. But vigilance during duty time is inevitable.
Tell us one thing that you don't like about nursing.
Though I greatly admire and applaud my profession, one thing that I really don't like is phlebotomy. Even though it is the first skill that every nurse is taught, still I don't like it. Skill of puncturing someone's vein in order to eke out blood, I still face difficulty with it.
Rate your crucial decision-making abilities on a scale of 1 to 5.
Throughout my life, I have decisions that have always benefited me and have provided me satisfaction. Opting for nursing was one such decision, which I still cherish and admire. I would rate myself a 4.8.
What extra precaution would you take while dealing with an elderly person?
Elders and children need special attention and care. I always ensure that I have thoroughly washed my hands and have worn a clean and sanitized dress, so that any transmission of virus or bacteria is nipped in the bud itself. If needed, I will definitely ask for help while assisting them. Also, maintain good communication with them.
How often do you use your phone while performing your shift?
I am always fully committed to my profession while performing my duty. Only in a case of utmost necessity do I pick up my phone or respond to messages. I won't talk unnecessarily on the phone while between shifts, as it will distract me, and I believe will affect my alertness.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Ruben Neum. I am one of the registered nurses practicing in this community health center. How may I help you today?
Hi, good morning, nurse. I am here to get some advice on my condition.
Sure, I am happy to help you. For the documentation, please tell me your full name and age.
My name is Angela Chris. I am 18 years old, a final year high school student.
Thank you, Angela. Now can you briefly explain your current problem, please?
Sure, nurse. Actually, I had panic attacks several times. I am experiencing sharp pains in my chest. So, I am here to get advice on managing them.
I am sorry to hear that. Don't worry, we can manage your condition much more efficiently.
Good to hear that.
Well, Angela, for my understanding, please tell me what you exactly experience.
Sure, nurse. I am experiencing episodes of shortness of breath and trembling. I can hear my heart pounding loud. In addition, I had chest constriction and sharp pain.
I'm sad to hear that. Be relaxed. I can assist you. Angela, how long will these symptoms last?
Sometimes, these last for even 20 minutes.
All right. Have you felt anything like this before?
No, nurse, I haven't experienced anything like this before.
For further confirmation, do you come across any other symptoms?
No, nurse, I don't have any other symptoms.
Angela, if you don't mind, can you tell me what you think will be the possible triggers of these panic attacks?
Nurse, I am not sure, but I think that I have an important exam coming up in 2 months' time. And I am very anxious about the approaching examination.
Being a final year high school student, I can understand your anxiousness about the examination. These symptoms are a normal response.
Yes, nurse, I know that being anxious is very normal, but my chest pain seems to be not a normal one.
I realize what you are going through, Angela. But, I can assure you that most of the students in such a situation, obviously, will be experiencing several realizations. Like you feel anxious, some others will be nervous, whereas others may feel fearful. These changes in our body can react in different ways, such as chest pain, increased sweating, stomach irritations, and sometimes even loss of consciousness. Are you getting my point?
Oh, is it? But, do you think this could lead to some other serious problems?
I can reassure you that, in your case, the panic attacks can be easily managed and are not a serious issue. As I said before, it is quite common before exams.
All right, nurse, can you please suggest some appropriate solution to solve this?
Sure, it is my pleasure. I can make some recommendations to you for self-care. If you feel such a situation, I recommend you to go to a quiet space and give yourself some time and consideration. The next thing you can adopt is to visualize something peaceful. Visualization has had a very good impact on several aspects. Other ways you can give it a try include practicing healthy habits, like resting, eating well, getting enough sleep, etc. I hope you will try them.
Yes, these suggestions seem to be very interesting. Definitely, I can look forward to this.
Thank you for accepting my suggestions.
By the way, nurse, is there anything else that I can do?
Definitely, there are some other ways, and by doing so, we can also track you. I will explain it to you. I suggest you return to the community health center weekly. And here, we will make you practice exercises for relaxation and breathing, which will be so beneficial to you. How does that sound, Angela?
That sounds cool. I assure you that I will come to the community every week, as you suggest, without any failure.
I am glad to hear that. Angela, do I need to address any more concerns of you?
No, nurse, it's all right. Thank you for your information. It was really beneficial for me.
Thank you for your kind words. Please feel free for further queries. I wish you all the very best.
Thank you. That is the end of your OET speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.